How to confirm a reactive rapid HIV test result. A reactive rapid HIV test result can be concerning, but it's important to understand what it means and the next steps to take. A reactive result indicates that HIV antibodies may be present, but it is not a definitive diagnosis. To confirm this result, follow these essential steps. First, undergo confirmatory testing. The Centers for Disease Control and Prevention and other health authorities recommend that every reactive rapid HIV test be confirmed with additional laboratory tests. The most common confirmatory tests include the HIV Western blot or the immunofluorescent assay. These tests detect specific HIV proteins and confirm the presence of HIV infection after a reactive rapid test. Another option is the enzyme-linked immunosorbent assay, which can also be part of the confirmatory panel. Additionally, the HIV nucleic acid test or HIV RNA test detects the virus itself and can help identify an acute infection. Next, follow a testing algorithm. Rapid tests can sometimes yield false positives, so healthcare providers use a sequence of tests to ensure accuracy. If the confirmatory Western blot or immunofluorescent assay is negative or indeterminate, further testing may be necessary. This often includes a repeat Western blot for weeks later or an HIV RNA test to rule out early infection or lab errors. It is crucial to consult a healthcare professional if you receive a reactive result. They can arrange for confirmatory testing, interpret results accurately, and provide counseling and support. Understanding the difference between reactive and positive is also important. A reactive rapid test means the test detected something that could be HIV antibodies, but it does not confirm a positive diagnosis. Confirmatory tests are required to establish if HIV infection is present. Consider the timing and sample type as well. Rapid tests often use blood from a finger prick or oral fluid collected by swabbing the gums. In contrast, confirmatory tests typically requiring blood drawn from a vein and processed in a laboratory. If confirmatory tests come back positive, the diagnosis is considered definitive, and appropriate medical care and treatment can begin. However, if confirmatory tests are negative, it likely means the initial reactive rapid test was a false positive. In summary, a reactive rapid HIV test result must always be followed by confirmatory laboratory testing. This process ensures accuracy, prevents false positives, and guides appropriate clinical care. Always consult healthcare professionals for testing and interpretation to ensure proper diagnosis and management.